how hormones can impact your relationships. As a psychologist, I want to talk about this. This is a big thing. Now, I'm Dr. Weiss, and I've been working with couples for over 35 years, and it's really important. When you think of hormones and relationships, you might think teenagers, okay, adjusting to those raging hormones, bursting through their body and slamming doors and maybe not liking you. And that may be the kind of the first thing comes up for you, but hormones influence your relationships in all of our lives, not just being a teenager and not just being 70, okay? Both men and women experience hormonal changes throughout their life, and this can affect your relationship. It can decrease your libido. It can decrease your energy level. It can make you moody, and who wants a moody spouse? That's not fun, okay? It can make you anxious. It can give you depression and try to motivate the other person all the time. It can really wear on your relationship, and you don't even know that it's really a hormone thing that can be fixed. Now, these hormone symptoms, they can really add extra stress to your marriage or your relationship, okay? And it can make the individuals kind of push away from their partners and not want to engage. We don't want that for you. We want you to have a really happily ever after, which you look into each other's eyes and be really content with each other. But how can you know whether or not you or them are experiencing hormone imbalances, and what can you do to fix it? Now, today, we have a highly qualified medical practitioner with an extensive background in adult medicine and hormone therapy. Now, joining us to discuss how hormones could be impacting your relationship, I want you to stay tuned and also listen to a special offer for our viewers. Well, welcome back. I want to introduce you to a medical practitioner who has a lot of background in regenerative therapy and helping people balance the hormones in their body holistically. William Salt, welcome, and thanks for being here.
Thank you, Dr. Weiss.
Well, tell us a little bit about you and what you do at Amazing Meds.
At Amazing Meds, we really take a specific focus on optimizing an individual's health with a primary focus on hormones. But in addition to that, we really like to take a comprehensive approach and factor in pretty much everything that a primary care doctor would look into. In addition to that, we really focus in on hormone depletion or excess.
Now, I'm a psychologist, right? And so I want to talk about how hormones can impact a marriage or a relationship, or even a parenting relationship for that matter. And if your mom's going through menopause, you might think you're the problem, right? It's like, why is mom mad at me, right? And she's not. She's got a hormone imbalance.
Yeah.
Or why is dad sitting in the chair watching TV? Why are we arguing? Can you talk a little bit about like how hormones can play into this dynamic?
I believe it plays a huge role in that dynamic in interpersonal relationships with friends and in particular family members. As we age, we naturally start to have decreases in certain hormone levels that play a major part in that youthful feeling that we all experience in our younger years, teenage and early 20s, and as we start to approach our 30s and 40s, and then get into the 50s and 60s, everybody really does notice that decreasing energy level, decrease in libido, concentration, sleep quality starts to worsen. And a lot of that usually is related to hormone changes.
So when your wife kind of taps you and says, "Well, you hurt yourself,"
yeah,
or Susie, you hurt yourself.
Right.
Like you hurt your food, you hurt out. You seem like you're sluggish, you're not getting things done. That could be a hormone issue, but it can mess up the marriage because it's like, honey, come on,
yeah,
you haven't done anything in 3 months, right?
Right.
And you could get mad at her as opposed to going, you know what, call Amazing Meds, find out what's going under the hood here. Deal with this thing.
Yes.
Okay.
Yes.
So that we can move back to who we used to be, who you used to be, who I used to be with you. Because if you're all depressed now and reacting to you.
Yes.
And now I'm not the same in this relationship.
It's just a domino effect. Yeah, that's a really good point, and I appreciate you bringing that up. If one of the members in the marriage is really suffering from a significant drop or change in their hormone levels, the partner is going to feel a certain types of way that if it's not addressed from the root cause of the problem, it really can develop and cascade into some serious marital issues. Once somebody does not feel desired, or they don't feel appreciated, or there's no energy appropriated towards their partner.
Right. And you're hitting a lot of good stuff there. Now, when someone gets their lab report, like I got one from Guys Amazing Meds, they did a great job. What can they expect? And, for me, we're talking about relationships. I'd be like, like in my office, if we can't figure out what the problem is, they both take psych testing. Okay. So then they're like, why am we both taking it? Because one of you's the problem, and I don't know who it is yet.
Right. It works the same way with the hormones. So with what we do, for instance, if we're dealing with the wife, and oftentimes with our patients, within 2 or 3 weeks, by the time we do our follow-up after the initial consultation, where we review the lab panel and develop a plan going forward, and in our follow-up, oftentimes by week 2 or week 3, there's a significant difference in energy and libido in particular. Those are very common issues and complaints that get dropped forward to us. And if the wife is brought all the way up, but then the husband isn't addressed, it's still going to have an issue there in the marriage or that partnership. Yeah, I agree. When similar to with your approach, when it comes to hormones, it definitely recommended that that both partners get tested and both are optimized.
What are some of the signs and symptoms? I mean, you do this every day. People come in your office. What are some of the signs and symptoms that people are saying, well, this one's going on with me? What's your kind of like normal person coming in, or maybe a couple people coming in that's like, hey, I struggle with this, or here's my symptoms, just so people can know, like, can identify with those.
Significant decrease in energy. By the afternoon, they just have nothing left.
1 or 2 o'clock.
Correct. Libido, very, very common. Just sexual interest. I still love my partner, but just, that there's definitely something wrong. Mental concentration, unexplained weight gain, in particular around the belly. With the ladies, vaginal dryness.
That's the issue.
Yeah, it is. And definitely a major factor. All of these can play serious, significant roles in terms of issues within a partnership or a marriage.
So, like, if someone's listening to this, what's their next step? What should they do?
Well, the first step always is, contacting us, and then one of our staff members will help facilitate getting a lab order or finding a lab, whatever state you're in, whatever city you're in the country. One of our staff members will help assist you in finding a lab that will be convenient for you, and you get a full comprehensive lab panel completed.
What page is this? Is that just
correct? Yeah, it's everything that your primary care doctor would check. In addition to that, we do a full thorough hormonal panel. Yeah. So we check the estrogen, the testosterone, the progesterone, cortisol, to see if it's chronic stress that might be playing an important factor in hormone changes. And from there, then we set up a consultation and a telephone sit down where we can really go in depth with all these results.
And that's not a 5-minute thing. That's like a half hour, 45 minutes.
Yeah, we really like to dedicate that type of time. I feel that it is necessary, especially with that initial consultation to go over lab work and to really take the time to get to know somebody and see what their real concerns are. And then also kind of take that team approach with our patients to really develop a plan together.
So Will, our audience is across America, okay? And I know that some people are going to say, I am in California, I'm in Florida, I'm in Maine, I'm in Texas. I can get my blood panel, but how do you help me after, like, I get this information? How are we going to get whatever I need to eat? You know what I'm saying? I'm in Alabama. How are you going to get what I need that you have to meet?
Yeah, so at Amazing Meds, we've really developed a good plan. So after we have that initial consultation, we go over your lab work. We are able to essentially have the medications shipped out to you directly. We really like to make everything as convenient as possible. Whether it's finding a lab center to get your blood tested, setting up a convenient time for you to have a full consultation. We can even set up video consultations in certain circumstances. And then if we are able to confirm that there is a hormonal issue, say there is a significant drop in testosterone level, which often is the case with those that come to us with complaints about low energy or low sex drive, we make it very convenient where we could develop that plan and, set up follow-up labs or whatnot, and then just have the medications shipped out directly, make it nice and easy for our patients.
And what I like about it is, first you identify the problem clearly. You're not guessing, okay? Then you make a plan, cooperative plan, okay? And then you actually follow through with that plan as far as getting them what they need to have so they can go to that optimal place. And then you stay in relationship with them. This isn't a one-time game. Like, they can stay in relationship with you guys for an indefinite period of time.
Yep.
And that's really powerful. And what I like about Amazing Meds is it's anywhere where they are. If they're in Tennessee or if they're in Montana, they can call, they can get their lab work done, they get it done. And I want to just share with our audience about your special offer, if that's okay. And, Amazing Meds, they're a wonderful company, and they have a special offer for you. You're going to see a phone number on your screen. I want you to call that number, and there's a code there. Use that code, because when you call, they're going to give you a special offer because you're part of our family. And we want you to have a healthy body. But we also want you to have healthy relationships. You know that. We don't want you to have to argue about someone being depressed or not desiring sex or feeling depressed. We don't want you to feel anxious. We don't want you to have things that in your body are causing issues for you, which are causing issues for us. We want you to be able to deal with that. And like I suggested earlier, my recommendation, Dr. Doug's recommendation, is both of you get tested, because then you're both on a track for optimal health. And if you want to stay in love and you want to have love last, you want your bodies to be as healthy as possible. I totally believe in optimizing your health. So I really want to encourage you to call the number. Both of you get tested, figure these things out, and have that consultation. And Will, I just want to say thank you for the work you're doing, how you're changing lives, and for spending some time with us today. So thank you very much.
Thank you very much, Dr. Weiss. Thank you for having me.